Hi everyone, thanks for tuning in again for Dr. Z for the best care for your neck and back. Today we want to talk a little bit more about cervical radiculopathy, and again last week we discussed that radiculopathy was a pinched nerve in your neck that causes pain down your arm. Today we're going to discuss what do we do about it. I used to be a physical therapist and I had about 3 years of working in physical therapy before I went back to do orthopedic surgery for the neck and the back. And in my experience, I know surgery should always be our very last option, and I'm a big believer in conservative care first. So primarily when we have shooting pain down our arm, numbness and tingling into our hand, weakness in our grip, the first thing we want to do is take a little break. Take a break from the offending activities that could be aggravating our symptoms. Sometimes it's sitting, sometimes it's lifting, sometimes it's basketball, sometimes it's something we're doing at work, sometimes it's something we're doing with our kids. We have to identify those factors and try to minimize their impact on our necks. The second thing is using anti-inflammatory medications. This comes in the form of ibuprofen or Aleve or something over the counter or something more prescription like Celebrex or Mobic. More stronger anti-inflammatories are steroid medications, which could also be used to reduce the inflammation. Reducing the inflammation around the pinched nerve can alleviate that burning and numbing pain down the arm. After using anti-inflammatory medications, the next recommendation is to begin some physical therapy. Under the guidance of a physical therapist, doing the right exercises for the neck and the back could actually take a lot of pressure off the nerves. The therapist would teach you some exercises to alleviate the pressure on the nerves, mainly by improving your posture and alleviating that constant stress of either that bone spur or that herniated disc that could be squeezing the nerve and causing that shooting pain. Also in physical therapy, we utilize cervical traction. You see that picture on our monitor here. By actually creating a force where we pull on the neck for a period of time could actually open up the space for the nerve and alleviate that pinching as well. Lastly, what we focus on is a possible injection. So an epidural injection that goes right around the nerve, or what we call a selective nerve root block, could actually reduce the inflammation around the nerve directly and significantly improve a patient's symptoms. Again, surgery is always our last option. We tend to focus on everything else first. We also recommend certain supplements that have a tendency to reduce inflammation in our body, such as fish oil and turmeric, and we have a lot of tricks up our sleeves. So keep tuning in. We're going to go over other secrets about taking the best care of your neck and back in our next episode, and we appreciate your time. Come see us if you have problems with a pinched nerve in your neck, and we'll give you our best recommendations. Thanks, guys. See you next week.